Welcome to Mission Evolution Radio Show with Gwilda Wiyaka, bringing together today's leading experts to uncover ever-deepening spiritual truths and the latest scientific developments in support of the evolution of humankind. For more information on Mission Evolution Radio with Gwilda Wiyaka, visit www.missionevolution.org. And now, here's the host of Mission Evolution, Miss Gwilda Wiyaka.
Toxic teeth. Have you ever wondered what toxins go into our dental work and the long-term impact on the human health? Mission Evolution Radio TV show is coming to you around the world on the X Zone Broadcast Network, xzbn.net. With us this hour to explore hidden toxins behind all diseases is Thomas E. Levy. Dr. Levy is a board-certified cardiologist and a bar-certified attorney that was inducted into the Orthomolecular Medicine Hall of Fame in 2016. After practicing adult cardiology for 15 years, he began to research the enormous toxicity associated with dental work, as well as pronounced ability of properly administered vitamin C to neutralize this toxicity. He's now written 13 books, with several addressing the wide range properties of vitamin C. His website, tomlevymd.com. Dr. Levy, thank you for joining us on Mission Evolution.
Happy to be here, Gwilda. Thank you for having me.
So, as a cardiologist, what drew you to research toxicity?
Well, I guess you could say there's an expression out there that is, when the student is ready, the teacher will appear. And that was the case for me back in 1994. I was practicing cardiology in Colorado Springs, Colorado. And I happened to meet a maverick dentist by the name of Dr. Hal Huggins, who, for those who don't know anything about him, is he's really the first true biological dentist, I think, on the planet. And to make a long story short, we got acquainted. And even though I had a very busy cardiology practice, he invited me to his clinic. He had people coming in from around the world to get a 2-week treatment. And I saw things that medicine told me don't exist. And I'm not in the habit of denying what my eyes have beheld. And at one point in time, I was at his clinic and I saw a little old lady got out of a wheelchair to get into her dental chair, just really weak, debilitated, getting hours of dental work, extractions, etc. The type of stuff, that puts a college student to bed for a week, like when the wisdom teeth come out. And she started getting more and more and more animated and energized as everything went by. And I said, well, this doesn't compute. And Dr. Huggins walked in and pointed at the IV. I said, well, thanks. I know what an IV is, Hal. He said, no, it's what's in it. I said, okay, I'll bite what's in it. And he said 50 grams of vitamin C. Well, I was like every other uninformed person in medicine that just thought vitamin C was something nice and you ate an orange and you were fine. And in fact, though, that literally in an instant changed my life, because that began my 4-year research on vitamin C before I wrote my first significant book, Curing the Incurable, where I just outlined all the literature that documents what vitamin C has done. And I emphasize that because even today, even though there's over 80,000 articles on the wide-ranging abilities of vitamin C to neutralize toxins and knock out infections in the PubMed resource of all the established literature, you know how many mentions there are of vitamin C in the two major textbooks of medicine? 0. Okay. So that really stunk right there. I said, I mean, I don't necessarily want to get into too much of what I think of the politics in medicine, except to say that, and I've maintained this for some time, there's more politics in medicine than there is in politics. And I take great distress in having to say that, but it's true. And so anyway, Dr. Huggins took a shine to me and said, hey, look, why don't you just quit what you're doing and come be a consultant here at the clinic? And that's exactly what I did. And that started in 1994 and saw so many different things. And as I like to say, too, I got my first true medical education from a dentist.
Okay. You gotta love that. Yeah.
Dr. Huggins taught me what nutrition and blood chemistries and that was all about. And I took what he has and I've tried to expand on it a bit in the past couple of years. I think Dr. Huggins passed in 2014, so I still wish he was still around and I could float some of the stuff by that we're seeing now these days. God knows what he would have thought about this horrible pandemic.
Absolutely. So let me get this straight. as fanciful as it sounds, there's this little old lady gets out of her wheelchair. She gets into the dental chair.
I should say she gets out of. I mean, she was helped out of the wheelchair into the dental chair.
Right.
I didn't mean she threw off her canes and started walking.
No. But she's getting one of these treatments where they're initiating or releasing all sorts of toxins into her system by doing all this dental work. Enormous amounts. The infection or whatever is going on in there is being released into her system. The only thing that she's being treated with is intravenous vitamin C, and she was getting better as she sat there rather than getting sicker.
Substantially. But let me tell you this, since you mentioned that root canals, for those who don't know it, are 100% infected, all of them. All right. We can go into detail maybe later on that. But many times, myself witnessing it, Dr. Huggins had witnessed it, even without the IV vitamin C, somebody might have whatever, different problems, headaches, muscle aches, this sort of thing. And the root canal will get extracted. And a few seconds later, the eyes will perk up and say, is it possible I could be feeling better already? I mean, those things just continue to knock you down nonstop, like the young people say, 24/7, and keep you down.
So by root canal, you mean a tooth that's had a root canal and then you remove the tooth?
Yes, that's correct.
So the root canal, even though they've done a root canal and all this stuff is supposed to get rid of the infection remains in the tooth with the cap on it or whatever else until it's extracted?
Yeah, they would like to have you believe that, but and I got to say, Dr. Huggins did not start this. Dr. Weston Price probably 50 or 60 years before Dr. Huggins went into the focal infection relationship of dentistry to all of medicine. And the root canal procedure, Gwilda, all right, is basically somebody comes to you because the tooth hurts. I mean, we're very simple people. We hurt, we want pain relief, okay? And I don't knock that. That's who everybody is. So, but nobody goes to the dentist feeling fine and wanting to have something done to a tooth. So they go there because it hurts. It hurts because it's infected, okay? And what do they do in the root canal procedure? Well, they literally shave off the top of the tooth and core out. They have a soft pulp inside the tooth that has the nerves and the blood supply and the connective tissue, and all the stuff that makes it a vital organ, if you will. And they naturally root out all of that. So in the process, they cut all the nerves. So basically, they embalm the tooth because it's still infected, but it no longer has the nerves coming out for you to feel the pain. I mean, how brutal is that? How crude is that? But that's how it's done. And they're always done because the teeth are infected. But just to make something else clear too, if for the sake of argument, and this drives me crazy, I've heard of some dentists actually telling patients we need to do a root canal on this tooth to keep it from getting infected, which is just bonkers. But anyway, once you've done a root canal, if for the sake of argument it wasn't infected for, it's going to become rapidly infected, because what do you do when you take out the pulp of the tooth? You take away all the immune defenses.
Oh,
There's
interesting.
no access to anything.
So
And,
there's
and a,
immune responses built into the pulp of the tooth.
sure, sure. I mean, there's immune responses wherever you have a blood supply and a nervous supply, and that's what the pulp is inside the tooth. So,
Okay.
and once a tooth is infected, it starts to break down the inside of the pulp. It destroys the structure of the tooth. It makes it called necrotic. That's basically like the term that you use when something is filled with pus. It
Hmm.
becomes
Hmm.
necrotic. And there's no way at that point in time that you can ever save the tooth again. I mean, in terms of restoring it to normal, I mean, you can do the root canal and probably be pain free and then be chewing on this infected tooth for however much longer you live.
And are
But
you, as you chew on the infected tooth, are you then releasing that infection into the whole system?
boy, are you. Between two molars, which is a common site for this, not limited to that, but between two molars, you probably generate more pressure than anywhere else in any biological system. I mean, when two molars get together like that, the amount of pressure that's generated there is enormous. Now, quite logically, what you just asked was, what does that do? Well, characteristically, a root canal or an infected tooth that's not been root canaled, either one, accumulates a collection of pus at the tip of the tooth as it drains the infected pulp. And so, yes, what happens? You chew down on that and you express the pathogens and the toxins directly into the venous system. And what's just as bad, and the ladies need to listen to this, is you also push it into the lymphatic drainage of the tooth. And the lymphatic drainage goes straight down into the breasts.
Oh my
I
goodness.
mean, breast cancer would not exist without infected mouths. Period.
Oh my
End of
goodness.
story. End
Well,
of story.
we're going to have to pick up on that interesting little tidbit on the other side of a station break.
Okay.
Dr. Levy and I will return very shortly, so don't you go away. This is Mission Evolution, www.missionevolution.org. What does breast cancer have to do with your teeth? With us this hour discussing toxicity in human health is the author of 13 books addressing the topic, Dr. Thomas E. Levy. Dr. Thomas, let's continue with that tidbit you just threw out there that links breast cancer and toxic teeth.
I would call it more than a link. A lot of times that people use the term, or scientists use the term link, association, correlation. No, this, Gwilda, is cause and effect. Cause and effect. Now, the interesting thing is, let's first go into a little bit about the physiology of cancer and disease in general. All disease, 100% of disease, is when you have an increased amount of oxidized biomolecules compared to normal reduced biomolecules. Oxidized meaning they've lost electrons, reduced meaning they have all the electrons that they need. That's it. There's no other disease process than that. Now, for a cancer to develop, you need the highest levels of oxidative stress you could find, short of the cell killing itself. Because when oxidative stress gets so high, then you have a self-killing mechanism called apoptosis where the cell dies. But short of that, the astronomical levels of oxidative stress is then what causes the the malignant nature to develop and cells to start replicating, etc. So then this begs the question, if it's astronomical levels of oxidative stress that is the primary provocative initiating cause for cancer, and this applies to all cancers, what circumstances cause such astronomical levels of oxidative stress? And the answer is a single word: infections. Okay. This is what causes oxidative stress, because everything, and this is why an infectious disease is so bad for you. Not because something is growing inside you per se, but everything about the pathogen is oxidizing more biomolecules, RNA, DNA, enzymes, proteins, etc., and making them inactive. And the disease process anywhere is how inactivated have your essential biomolecules become, where are they located, etc., where are they concentrated. There is no disease other than that, other than the oxidation and where it occurs.
So if
Now,
that's the case, then does the weak link break down?
the weak link.
In other words, if you have a part of your body that's, a little off anyway,
Oh,
when you hit with oxidative stress, does it tend to impact there first?
sure, sure. And like genetic weak links, for example,
Hmm.
mean you're basically missing an enzyme or some metabolic pathway that keeps you from producing oxidative stress. But when it's absent, you produce more oxidative stress, and then that makes that area predisposed toward the further escalation. So what happens too, and this is outlined in a paper I wrote, got a couple hundred references. You mentioned my website, tomlevymd.com. It's called Root Canals Cause Breast Cancer Frequently. Okay. And all the documentation there. But the point I want to make there is, and we actually have thermograms where you can actually see, not all the time, some patients with the root canal, you can see the red line going from the root canal, tracking down the lymphatic channel and going straight into the breast.
Oh my.
Now, when you have these pathogens in the lymph, that's what we're talking about, draining the lymph, the lymphatic fluid, which is similar to blood and plasma, except without the red blood cells, is then this then comes down, and in order to for the lymph to exit the body, basically reach the armpits and then go into the circulation, it's got to pass through the breast first.
Oh.
So the breasts, if you will, are actually more or less filtration organisms for this toxic lymph coming out of your mouth. Now, we know from studies where you develop a breast cancer, there's an astronomical increase both inside the cancer cell and surrounding the cancer cell of these pathogens. Plain and simple. They've been cultured out, they've been documented. And so then this comes in, well, what are the factors then that escalate this mechanism? Well, obviously the first mechanism is if you're draining infection, it's going to work. It's going to be a lot easier to develop foci of infection in the breast and elsewhere, and eventually in the armpits. Because remember, the purpose of the lymphatic system is to eventually render the lymph sterile. Okay, that's what it's trying to do before it finally exits the lymph nodes and goes back into your circulation. Otherwise, everything you'd be encountering outside the blood system would go inside your blood and begin a sepsis or a bacteremia or something of that sort. Now, so accumulation is one thing. So concentration, accumulation. This is why, and maybe a lot of folks don't know this, but the larger breasted women are more prone to breast cancer. And in fact, women that have reduction mammoplasties reduce their tendency, predilection toward breast cancer. Well, why is this? Gravitation, Gwilda. Gravitation. I mean, for a large breast is pendulous. It's it's got to work its way back up to go out through the armpits and the lymphatic nodes there. So, a practical point for women, of course, the first thing is to make sure your mouth is clean. That's the other thing. But I think for most women, when they go to bed at night, laying flat on their back and letting gravitation work with them and not against them, a breast massage helps clear out any lymph that is accumulated in the breast, sends it off into the armpits to be sterilized. But it's and that's probably why men get no breast cancer. I say no breast cancer. I mean, they get 1% of the breast cancer. Okay.
Right. Because there's more places in women for it to get all backed up and hang out and create problems.
And even on an obese man, the tissue amount is small and not a lot of areas for it to get backed up.
Right.
And so
So,
this is
so
with all
I
cancers. I'm sorry, go ahead.
That's okay. So, women's habits of wearing bras with wire in them and all this and that, wouldn't that also create places for it to get backed up and stuck?
Yes, yes. I mean, I'm not saying never wear a bra, but boy, is it important to have one that properly fits. And of course, it's especially hard, as you alluded to, for a very large-breasted woman to get good support without other areas of hard constriction.
Mhm.
Yeah, so
So,
that's the
you said get a clean mouth. Does that involve going in and having all the teeth? And at our age, sometimes there's a lot of, there goes all your molars, right? That have had a root canal. Have them extracted.
for optimal health. Yes, the root canals have to go, and they have to be extracted properly because um, and there's a lot of dentists that'll take out a tooth and then they just wait for the blood to stop bleeding, and the procedure is done. Well, in the case of the root canal, the tooth needs to come out, and then you need to scour out the remaining part of the socket collagen in the infected bone at the bottom to allow good, healthy bone to grow in. And because of that, because most extractions do not do that, they have another phenomenon that causes a lot of problems in dentistry called cavitations, where you don't realize it, but when you get the right type of x-ray, you see a hole sitting in your jawbone. And that hole is filled with, technically speaking, gangrenous material, infectious gangrenous material. So you need the root canals out. You need good gum care because it's usually, almost always, chronically infected gums that either lead their way to get inside the tooth that way or that a cavity up top lets pathogens down. But it's very difficult to get an infected tooth if there's no cavities and there's healthy gums.
Because the
Okay.
gums keep a nice seal between the tooth and the
Correct.
material that
Absolutely.
goes through your mouth. Okay, so that's why receding gums can be such a problem, and you end up losing a tooth or having a root canal.
And that's
Is that
true. And
correct?
another thing, too, that's little realized, I covered it in one of my books, is that if you do regular gum care with a water pick or another type of water irrigation system, put a couple tablespoons of 3% hydrogen peroxide in there, the rest of it warm water, maybe a little mouthwash if you want some taste, and you run that past your gums once a day, it's very difficult for you to ever have infected gums. Matter of fact, some dentists appreciate me saying this, others go crazy, is I am completely anti-flossing, okay? Because there's nothing flossing gets out that water picking doesn't get out. And
But the
water
flossing can
picking,
cut down into the gum.
exactly, you
Yeah.
traumatize your gums. Even if you do it perfectly, you traumatize your gums. So now, in the rare occasion somebody might have a certain anomaly where something always packs up, well, maybe you need some floss for that one area. But for all intents and purposes, if you floss perfectly and then water pick, you're going to get a lot of stuff out. If you water pick perfectly and then go to floss, there's nothing left to get. So, and it's very similar. It's like going out and gardening and getting your hands fully black. Do you get your hands clean by scraping them? No, you get water and you wash them. No different for the mouth. Now, the other thing too that needs to be emphasized. So, infected gums and infected teeth and infected tonsils. Okay,
Oh, interesting.
because the tonsils are in line with the jawbone. And wherever you've had, for any reasonable period of time, probably just a few months, and longer, of course, but a few months, the amount of pathogens that are being drained from these teeth and gums into the tonsils completely overwhelms the tonsils. The tonsils are what I call wimpy immune organisms. They can deal
Well,
with a little low grade presence, but when you flood them, they just
we're
become infected themselves.
we're going to have to pick up on the tonsils on the other
Okay.
side of a station break. Dr. Levy and I will be right back to continue our discussion. So stay right there. This is Mission Evolution, www.missionevolution.org. Is there something that can neutralize all toxins and resolve most infections? This is Mission Evolution, missionevolution.org. With us discussing effective treatments for eliminating toxicity and the resulting diseases is Dr. Thomas E. Levy. His website, tomlevymd.com. Dr. Levy, let's get practical. I'm sure everybody now is going, oh, I have to lose all my teeth to find my health, around like this. um, and the special treatment that you just described isn't practiced by most dentists, unless I'm mistaken, where you go down and you really get into the jawbone actually to clean out the infection. So,
Not
given that most
upon
of,
extraction. Upon extraction. I mean,
yeah,
there's no
yes,
way to
upon it,
clear out the infection without the extraction, right?
exactly. But when you go to a regular dentist, most of us, even in larger cities, they're probably not privy to this information. So, what's a person to do?
You need to do your best to, with an online search, find what's called a biological dentist, and they have some organizations. If somebody sends me an email, I can give a link to different organizations that you can find something like this. But the thing is, and you already sort of alluded to it, and so I'll state this because it shocks some people, and I want to shock people, but I don't want to exaggerate. And to me, the shocking statement is the worst thing you can do for your health, in my humble opinion, is to have and see a regular dentist. And the best thing you can do for your health is to have and see and utilize a well trained biological dentist. Regular dentists, this is not meant to be disparaging, but descriptive. They're tooth mechanics. They have no training in the biology of teeth or their impact on the health or the dissemination of infections. All they're there for is to try to make everything come together nice and not be worried about the nature of the anesthetic, not be worried about any of the factors that a physician might be worried about in treating a medical condition. So you have to have a dentist that's trained properly. Because another thing too, although we probably don't have time to discuss it, is we still have the problem with mercury amalgam fillings. Okay, people have the, and and so a lot of people, when they finally hear about this, they go run out to their dentist and they get their mercury amalgams taken out, and they get worse. They get worse because there's such an enormous exposure to mercury when you're taking them out. If you don't follow the right protocol to protect the person from the mercury that's coming out as they're extracted. So
So, does a rubber dam in the mouth help with this, or do you need
absolutely, a
something
rubber
more?
dam is an important part of it. Absolutely. You're very well informed there, Gwilda. No, rubber dam is important on that. And the other thing too is to give things like vitamin C either as an infusion or good oral liposome encapsulated vitamin C before, during, after. All of these things give a strong buffer against the acute toxin exposure, not just of mercury, but of anything else. Okay, I generally advise dentists to take these type of measures on just about any dental procedure, but especially when you're extracting an infected tooth or something of that nature. The type of toxins that are present inside an infected tooth, in some studies, are substantially more potent than botulism toxin, which is
Mm.
considered by medicine currently to be the most toxic toxin known. So there's a
So,
lot of stuff out there. And you said, does the dentist know about this? No, doesn't. It doesn't know about it unless he or she has done extra training. And if all they've done is listen to what the American Dental Association has said all their lives, they're not going to do anything about it either. They're they're comfortable doing. And I got to say this for all dentists, traditional as well as, they're hard workers. I mean, I've never seen a dentist that I did not admire the work ethic of. I mean, they sit on that little chair and they stare inside mouths for 10 hours a day doing intricate work. It's hard work. uh, Doing lousy dentistry is hard work. So why do lousy dentistry? Do good dentistry as
you're
hard
going to be
work.
working anyway, right? So, is
Exactly.
is a biological dentist the same kind of like the same thing as a functional medicine person?
Yes, actually, that's a perfect way of putting it. Yes, and the thing we haven't touched upon that everybody needs to understand and realize is, where the root canals are. Those have characteristic images on the X-ray, but you don't know where the chronically infected but pain-free teeth are. This is something that I came upon and put in my book, Hidden Epidemic, is that, well, as people get older, hey, we know things break down. Well, you chomp on a tooth, you may not realize it, but you might have split it, okay? And you might have exposed the pulp and not realize it. And then the pathogens you get in there, next thing you know, if you're looking for it, you'll see a big round abscess on the tip of an otherwise normal tooth. That's a chronically infected tooth, and it's just as bad or more toxic than a root canal and needs to come out.
So
How
how
do you
about
teeth? You detect it with a cone beam examination of the mouth, 3D X-ray. Cone beam computed tomography of the mouth allows you to see these because regular X-rays miss them all the time.
so that's the one where they run the machine around like this?
Right. And I mean, boy, then when you look at it on the computer, you get all the different angulations. It's got and it should be interpreted properly. So I encourage all dentists that use it. I mean, absolutely interpret it as best you can, but make sure it gets sent off for a proper interpretation because you're setting yourself up for problems because you're concentrating on the teeth and there could be another abnormality that you just completely overlooked that could come back to bite you malpractice wise. So use it, do your diagnosis, but send it off for a qualified interpretation as well so that you don't stumble over yourself.
Well, isn't that the case with all medicine? The tests are only as good as the people that read them.
Sure.
Yeah. So, if a person is, average person of, over 20 or 30, and they've had dental work, what's the likelihood that they have leaky fillings that are still infected and all this same problems we're talking about?
Uh, depressingly high, depressingly high. Uh, people say, well, when should I get this test? Well, I think, my opinion, just you get a blood glucose to make sure you're not diabetic, just like you get a blood count, make sure you're not anemic, all these sort of things, routine blood tests. This should be a routine initial test. I don't care what age you are, when you first see the doctor, whatever, or the dentist, because
I'm sorry, what test?
the cone beam examination of the mouth.
Okay,
Okay.
gotcha. Hmm.
Because if it's normal, that's great. And that means if you're 15 or 20 and then you're 35 or 40, and then all of a sudden you develop high blood pressure or diabetes or another chronic degenerative disease, then it's time to redo that test. And you'd be amazed how many times the excess toxin load, oxidative stress from that infected tooth pushes your body over the edge on any of a number of other chronic diseases. Because remember, like I said, I'll repeat, all disease is too much oxidative stress, too many biomolecules not functioning because they don't have all their electrons. That's it.
Now, a lot of people associate all disease with inflammation, but doesn't this oxidative stress create the inflammation?
That's correct. All a matter of definition. Very good, because vitamin C is the prototypical antioxidant and the most important one in the body. Many
I mean,
others.
everybody's heard about vitamin C, and
Well,
all of a sudden, it's the miracle drug. How do you
well,
give it to people? Is it
let
intravenous?
me make the point about the inflammation, and then I'll get to that, which
Okay.
is when you have increased oxidation, which means usually you have infection, you use up all the vitamin C in that area trying to deal with it. And when the vitamin C goes down to zero or near zero, then inflammation results. So, really, severe acute focal vitamin C deficiency is the same thing as severe focal inflammation. You can't have one without the other. If you have inflammation, you don't have vitamin C there. And if you don't have vitamin C there, you have inflammation. And then the inflammation triggers an acute immune response. And this is interesting because guess what? The first cell of the acute immune response it's the monocyte, which has 80-fold, 8,000% more vitamin C inside it than any other cell. So it's
So learn from the
literally
body, right?
right. It's the immune system, as I put it together, you won't find this in a book. I see the primary role of the immune system, if not just about the only role, but the primary role is to quench inflammation. And the way it quenches inflammation is by delivering vitamin C to the areas that are most depleted.
And so the more inflammation you have in your system, and with our lifestyles and everything going on right now, it's probably a lot for most people that are middle age or over,
No
then you're
question.
just burning vitamin C like crazy.
Exactly. And
And
that's why you were asking about taking vitamin C. You know, no two people have the same need. All right. No two people have the same need because no two people have the same uh, degree of infections in their body and other things going on that would continue to generate oxidative stress. Uh, General recommendations, most people should be, in my opinion, on between 3 and 9 grams of vitamin C a day in divided doses, either ascorbic acid or sodium ascorbate. Um, a good liposome encapsulated form of vitamin C is also very good because it helps get the vitamin C better inside the cell, whereas regular vitamin C, you're just getting it into the bloodstream. But IVs, whenever you can get it, the problem with IVs is they're getting so expensive. I mean, we're pricing ourselves out of existence for so many good health regimens. Okay, and
right,
I
right.
mean, there's a type of liposome C that I think is the perfect liposome C from a company called Live On Labs that I've worked with for 18 years. So many people have tried to imitate them, but they can't. And I'm able to see the fact that for a fraction of what you spend for one IV, you can
We're
get
going
enough. I'm
we're
sorry,
we're
go ahead.
we're coming up against a deadline here. We're going to have to
Okay,
take
all
another
right,
station break.
that's fine.
Please stay with us as Dr.
Sure.
Levy and I continue to explore the hidden causes of disease. Okay, so we're all toxic. What can we do about it? This is Mission Evolution, missionevolution.org. We're continuing our discussion with Dr. Thomas E. Levy. His website, tomlevymd.com. Dr. Levy, it's been pretty fascinating looking at all vitamin C can do, and you were just getting into there's different kinds and how to do the dosing, and that they used to do IV, but now it's really expensive. If a person is dealing with a lot of toxicity and they're clearly sick on a lot of different levels, which direction would you have them go with the vitamin C?
Well, without sounding silly, you really take as much as you can and can tolerate. Okay, that different. I mean, some people will have a bowel effect, a flush effect when they take 2 or 3 grams, and others won't get that effect until they take 40 or 50 grams. So there is no set dose. Most people adjust it according to how they feel. All right, and I've often told people that generally speaking, if you've never been a supplementer of anything in your life and you start taking vitamin C in just about any amount, you're going to develop a new health instinct. You're going to become so much more aware of your body, and you're going to finally realize that some days where you thought you were feeling good, you weren't really feeling good. You were just getting by. And then because of that new health intuition, and once you get on a certain dose of vitamin C, then you're much more able to know when you're having perhaps a new infectious stress coming into your body because it knocks you down. Doesn't make you sick, but you say, "Wow, I'm not perky today like I was yesterday." And these sort of things, people are then able to periodically adjust supplement dosing to better meet those needs.
So, in this day and age, young children end up going in and getting major fillings and this sort of thing. So many of us have probably been toxic our entire lives, from what you're saying. Do you think this really affects the way a person is able to think, able to learn, able to get around in the world?
Everything. Well, I'll tell you the title of my new book, not written yet, but it's going to take a while. The title of the new book is Toxins Cause All Disease. Okay. Because the only way toxin causes disease is by oxidizing something. And we've already talked a little bit about oxidation. If you don't have oxidation, you don't have disease. So it all comes down to two factors. I'm really getting simplistic here, but it's true. Two factors, which is you need to take in as much quality nutrition and antioxidants to reverse the oxidation at the present. But as Dr. Huggins told me many years ago, he said, Tom, you can't dry off while you're still in the shower. And so you got to turn off the shower and stop either eliminate, metabolize, or block the new toxins coming in. So there's two sides. There's the old oxidation, and you got to stop the new oxidation to get an ultimately positive clinical result.
So
And
if
certainly this applies to everybody. Yeah.
so, what are the symptoms? What can a person watch out for that would indicate, hey, I'm actually dealing with this? Or do you just have to say, I've got dental work, I can plan on I'm dealing with this?
Well, dental is not the only thing. Dental is the most important thing and most significant in most people. But we have two other big factors now that one that's just being realized and one that's just evolved. The first one is heavy metal accumulation. We now have evidence to show that so many people have astronomical levels of heavy metals inside their bodies, including mercury, including lead. And just because they don't have a flagrant disease doesn't mean they don't have 75, 85, 95% of the accumulation that's going to precipitate that disease once enough new oxidative stress comes in. So a topic beyond what we could deal with, but people need to be with a functional doctor that can help them do different forms of chelation and start getting these metals out.
Now,
The
where do
oth-
they come from? Where do they come from? So I know the mercury probably from your mouth, the dental work.
That's right.
The lead, does that come from the gasoline? Where does
Gasolines, right.
okay.
And you really stumbled across an interesting point because in 1999, in the Journal of the American College of Cardiology, they did biopsies on patients being considered for heart transplant. They had big, huge, enlarged congestive cardiomyopathy hearts, heart failure. And in the biopsy, they did heavy metal levels. And and they found there to be 2,000 fold, that's 2 million%, 2,000 fold more mercury inside those cells. They found 1,000 fold more antimony inside those cells. And that a lot of people haven't heard of antimony. But guess what? Antimony is a heavy metal that's just as toxic as arsenic. And you know where we get most of it? Water bottles, plastic water bottles.
Of course.
Okay.
Trying to
I,
be healthy and we're shooting ourselves in the foot.
there's a lot of other reasons to avoid plastics. They're talking about all the shards and other pieces of plastic and this, that, and the other, but they use antimony, this horribly toxic heavy metal, to make the plastic. So when you have a bottle and it's hot and it's been sitting out there, I talked to one veteran who had been in Iraq. They enormously heat. They bring down pallets of water every day, and he had to drink 24 bottles a day. And he said every time he drank a bottle, he felt sick for a moment.
Mm.
So, but obviously you gotta hydrate. We have to go back to glass. Gwilda, why is it Coca-Cola was in bottles eons ago and now it's in plastic? Let's go back to bottles.
It'd certainly be more healthy, wouldn't it? So it's that time in the show, Dr. Levy, when I get to ask you, what's your mission?
Well, my mission is for people to become as educated as possible about what's best for their body, and maybe just as important or more important, to have the freedom to pursue it. Okay, I told you before that there's more politics in medicine than there is in politics. And I've evolved a lot myself. And I now have, with obvious exceptions, a great deal of hatred for modern medicine, many of which I think should be incarcerated because they deny people therapies like vitamin C in the intensive care unit to reverse sepsis, etc.
Wait,
They
what do you mean?
deny.
What do you mean they deny people?
I mean, families will come up, they'll have another doctor consulting with them, they'll have a pile of articles this high that say, please give my father, mother, brother, sister IV vitamin C, and they say no. That doctor where that patient dies needs to go to jail.
Hmm.
So now I'm not saying all doctors are like that, but a depressingly large number are. I mean, that's probably the type of email I've gotten more frequently over the last 15 to 20 years than anything else is the ICU intensive care. How do I get my dying family member intravenous vitamin C? Same thing over and over and over again. So
So are the tests out there? Is there the evidence that that we can present to the medical people?
sure,
Um,
remember the 80,000 plus articles I told you about? They're all
mhm,
there. They're
okay.
all there. They're all unequivocal. They're not suggestive. They're unequivocal.
Are they peer
That's what. That's
reviewed
why.
and all
That's
that
why I
fun
use.
stuff?
That's why I use the term evil for modern medicine. I don't throw out inflammatory words lightly. I'm also a lawyer. I know what words mean, and I know their significance. And I'm not trying to inflame. I'm trying to inform. And there you go. Trying to inform. And if I can inflame to inform, that's okay too. But the point is what I'm saying is factual. Okay.
So if we could get hypothetically, if we could get intravenous vitamin C accepted into hospitals and into treatment for people as a routine thing, even covered by, go figure, insurance companies, what kind of changes would you see? What would you expect to see in health?
If vitamin C were completely, and some other important nutrients, but vitamin C in particular, and there's a lot of reasons I could tell you, but in particular, if vitamin C were used completely, freely, conservatively, in my opinion, it would eliminate the need for over 50% of all pharmaceuticals.
Well,
Maybe a lot more, but I'll stay conservative and say 50%.
there's the motivation, right?
Yeah, yeah, I don't need to spell out that motivation too much further, do I?
No, no, no. So, what outside of vitamin C, and we're about out of time, but outside of vitamin C, what are the best supplements to deal with chronic disease?
I put together what I call my Super 8 supplements. It's not that I'm selling them, so I'm not making any money on this, but my Super 8 are vitamin C multigram, magnesium multigram, vitamin D3 to get a level above 50, vitamin K2 for calcium metabolism, and then the big four for increasing energy production inside your cell via ATP, which is niacinamide multigram, riboflavin, which is vitamin B2, 400 milligram, coenzyme Q10. These are all parts of the electron transport chain in the mitochondria, up to a gram a day, and methylene blue, which actually goes in at the end and starts triggering massive amounts of ATP production. The number of people that have started this Super 8, the feedback I've gotten is enormous. I've
Oh,
only put
that's
it together about a year ago.
well, that's wonderful. Unfortunately, we are out of time. But Dr. Levy, thank you so much for coming on the show and sharing your knowledge with us.
My pleasure. Thanks for having me, Gwilda.
Our guest this hour has been Dr. Thomas E. Levy. Dr. Levy is the author of 13 books covering toxicity, nutrition, disease, and health. To find out more about Dr. Levy, where you can find his books and all he has to offer, visit his website, tomlevymd.com. This has been Mission Evolution with Gwilda Wiyaka. For more information or to enjoy our past archived episodes, visit our website, www.missionevolution.org. But please be sure to join us right here next time, as this show will continue bringing information, resources, and support to our evolving world.